All righty. Well, welcome everyone. Thank you all so much for joining us today. My name is Ariel Green, and I am the Caregiver and Education Specialist for Care Partners. And today we are here to learn more about how we can partner with our doctor, how we can advocate for ourselves and our loved ones, and build your healthcare team, if you will. And before we get started, I would like to just show a brief, small commercial, if you will, that kind of explains a little bit about who we are at Care Partners. I understand some of you all may be familiar with us, some of you all may not. And so just want to make sure that you have the resources that you all need. As I mentioned before, please feel free to use the chat. We want to try to make this as interactive as we can today. I may mute you at some points just to make sure we maintain quality of the audio on today. And after I speak or present the commercial or slideshow, that's about 1 minute, I will turn it over to our wonderful sponsors with AARP. I have Ms. Rose Childress today, and she's going to give you a brief overview, and then we will introduce our speaker and we'll get started. So thank you all for joining. I'm going to go ahead and hit start on the video. And Angela, if you can give me a thumbs up if you can hear the audio once we get going.
It's too quiet, Ariel.
Okay, let's see if I can get it louder. Okay, we're gonna start it over again. I'm gonna turn up my volume. Let's see if that's better.
Care Partners is a nationally recognized nonprofit that bridges the gap
Better.
care and social services by providing everyone health intervention and empowering caregivers with care and support. We do this through our caregiver support services, which includes online telephonic care consultation, peer support groups, and caregiver educational workshops. Together with our partners and core volunteers, we offer social protection and engagement to families from toddler to family. The gathering place provides families an opportunity to engage in meaningful, everyday activity programs for individuals with mild to moderate conditions. We also Their purpose is committed to giving passionate communities of healing, support families and working with and more information on better learning services.
Awesome. Thank you all so much. And if you have any questions, like I said, please reach out to us. We definitely want to support you along your caregiving journey, which is why we have these wonderful programs. So without further ado, I'm going to turn it over to Rose. She is with AARP, and she's going to tell you a little bit more about what they do. They have sponsored a lot of our education programs, and so we're really happy to have them here today. Rose?
All right. Good morning. Okay. Good morning, everyone. I'm very happy to see all of you and happy that you've taken the time to come and get some very, very important information in regards to caregiving. Now, let me give you a little information about AARP. AARP is a nonprofit, nonpartisan member organization that's dedicated to providing information such as what you're going to get today from Care Partners and resources that are important to people 50 plus and their families. Now, our social mission is to empower people to choose how they live as they age through educational offerings like our caregiving workshops, cooking classes, legal workshops, and a host of other engagements. And now these offerings provide our members and friends with information and educational tools that are helpful for their daily lives. Now, our founder, Dr. Ethel Percy Andrus, was an educator and believed that all people could choose how they live as they age. And now, if you're interested in learning more about us, AARP, the organization, or becoming a volunteer, then visit us at www.aarp.org/nearyou. And we can be found on all social media platforms. And I'll be putting that information in the chat for you. And so, and again, I'd like to welcome you here this morning for one of our educational offerings, but also go to the aarp.org website near you, or if you're in Houston, and see some of the other offerings that we have. In fact, as part of our Prevent Fraud initiative, we will be having a paper shred event the first Saturday in June. And we know from what we've been seeing on television and all that fraud and scams against older adults is just rampant, you know. So so that's one initiative that AARP has that we have in support of our 50+ community. And there are a lot of other things, such as some events in the Houston Botanical Gardens, free movies and things like that. And we would love to see you out, because as Angela, I'm sure will mention to you, part of caregiving is self-care. And so we try here at AARP, we try to cover all the bases, everything that goes along with the 50+ community, whether it's education like we're having today, or it's the paper shred event, which is to help prevent fraud, or the activities like the movies for grown-ups, or the botanical garden activities, you know, all of these, you know, to promote socialization, because that's all goes along with caregiving. And so we want, I'd like to see you. And if you're interested, I will have the information in the chat where you can come and be a volunteer with me. And so now I'm going to turn it back over to Ariel Green.
Thank you, Rose. And I just want to second everything she says. AARP is an excellent resource. Even as a social worker, I find myself going to AARP and looking up articles and sending it to caregivers. As far as education, it is just remarkable, the resources that they have. And I see your Prepare to Care book in the background, Rose. That is a wonderful resource. And so if you're ever out at one of our in-person events, we do have those. We can also get them to you as well. So thank you, Rose, for being here. So I'm going to introduce Dr. Caddick, who I've had the pleasure of working with for, I want to say, at least 3 years now, which has been remarkable. We met right before COVID. So we have not seen each other in person in a very long time, maybe a handful of times, but it is so nice to have you here. And thank you for being an advocate for older adults and caregivers in the Houston area. And so I'm just going to tell you a little bit about Dr. Caddick. She is a board certified geriatrician with a focus on geriatric education, hence why she is here today during this presentation. And she also is focused on developing models of care for older adults and their caregivers. She currently serves as the Associate Chief of Staff for Education at the Michael E. DeBakey VA Medical Center. In addition to her education role, she has a clinical interest that includes dementia, delirium, pain management, and a complex of other needs that older adults face throughout their life. She serves as the primary investigator for the CEDEX GWEP, which is a 5-year program focused on geriatric interprofessional education and primary care. So she is helping professionals. She is also helping you as a caregiver. She is a huge advocate for older adults and caregivers, and we're so happy to have her here today. And so Dr. Caddick, I'm going to turn it over to you. I'm going to mute myself and fade into the background. If you all have any questions or need anything, please message me on the chat. So thank you.
Thank you, Ariel, and thank you, Rose and AARP for sponsoring this. I'm going to start out by making sure I can share my screen. Good. I am getting a thumbs up. So that's awesome. So it really is my pleasure to spend some time with you all today. And the topic we're going to be talking about today is something called age-friendly systems of care, but really focusing around what matters. And what matters is relevant to each and every one of us, but especially to older adults. So I hope you will all go home with tools that you can use, whether this is for yourself, for individuals you're caring for, or others that are in your life that could take this to their medical providers. So just to give you a bit of a roadmap of where we're going today, I want to start out just introducing to you all the concept of age-friendly systems of care. That sounds pretty academic. It's really not. I think you're going to be seeing more and more of this, and there's a lot already happening in this area here in Houston. So I want you to be aware of that. I then am going to spend the bulk of our time together talking about matters most as the foundation for all other medical care. And, this makes really intuitive sense. I love talking with caregivers and older adults about this because I often see heads nodding. And yet this is not how clinicians have practiced medicine for the last, many, many decades. This is really a change. So I think it's so important to be advocates in your own healthcare and bring this to the clinicians who you are seeing. And I want to end by hopefully motivating you to really discuss your values and goals with healthcare providers. So I'm going to start out with a little bit of background. This is one of my favorite slides to show because we really are going to be reaching a milestone in the history of mankind coming up just in a few decades. We are moving for the first time in history from our population looking like a pyramid to it becoming a pillar. So always throughout history, we have had more younger individuals than older individuals, hence a pyramid. But that's changing. People are living longer. We're having growing older adult populations, and in general, less children are being born. So by 2060, it is predicted that our population will look like a pillar, which, as you can imagine, is going to have significant implications, not only for healthcare, but for our entire society. So lots of opportunities as our older adult population grows. In fact, with the baby boomers, we know that about 10,000 people are turning 65 years of age every day. This is leading to a significant increase in the demand for geriatricians, which is what I am. And geriatricians are just physicians who have specialized in caring for older adults. Now, we have amazing colleagues from all the other professions in medicine, be they nursing and physician's assistants and social workers and pharmacists, and I could go on and on, who also specialize in geriatrics or caring for older adults. But despite that, there are not enough of us who have specialized in this to see every older adult. In fact, we are going to see a 45% increase in the demand for geriatricians just in the next couple of years. And we do not have that many people going into this specialty. So this is what prompted several organizations, and I'm not going to read all of them to you, but they include the Institute for Healthcare Improvement, which is one of our main quality organizations in medicine, as well as the John A. Hartford Foundation, which is a real advocate in the field of aging and invests lots and lots of money into aging research and education to develop what is called age-friendly health systems back in 2018. And what they said is we need to have a system where no matter where an older adult is seen, be it inpatient, outpatient, in the emergency room, in long-term care, and no matter what medical professional sees them, these three things happen. They follow an essential set of evidence-based practices. They don't cause harm in the medical care of that individual. And what I think perhaps is most important, they align with what matters to the older adult and their caregivers. And they have a system where clinical sites can apply, We go through a very rigorous process of how we are going to meet metrics around this. We have to report to the Institute for Healthcare Improvement, but we can actually be formally recognized as an age-friendly health system. And over 3,000 clinical sites have earned this recognition in the United States. So a lot of these are right here in Houston. This is just a sampling of them. I want to point some of these out. Here at the Michael E. DeBakey, we have this designation in our geriatric clinic. In fact, we were the first VA clinic in the nation to earn this designation. They also have it through our home visit program and what we call our community living center, which is like an inpatient rehabilitation. Our colleagues over at UT Health have it. You can see in multiple areas, including the entire Memorial Hermann Hospital. Baylor St. Luke's Senior Care Clinic, with obviously Baylor, has this. The Houston Methodist Health System has been designated age-friendly, as well as all of the family medicine clinics at Baylor. And this just continues to spread. So we are very, very excited by how this has grown within our medical center here in Houston. I think this is really, really remarkable. And I would encourage you, when you're seeing a healthcare provider, it's okay to ask, have you all earned age-friendly designation? Is that something that you know about? Because it just shows that they are focused on the care of older adults. Okay. So age-friendly health systems, they have centered them around what they call the 4 M's. And I like to tell my trainees, the medical students and residents that I take care of, those are not the chocolate candies, right? These are the 4 M's of age-friendly care. They are what matters, which is going to be our primary focus today, as well as mobility, mentation, and medication. And I'll just touch really briefly on those at the end of the talk, because these go together. We really can't separate them out. To provide great age-friendly care, we need to encompass all of these. But what I would say is that what matters is the foundation. That is what we build all other care on. So we're going to jump into that a little bit. So just to give you a definition, because this may be the first time you're seeing this or hearing about what matters, this is the definition we're provided. It's knowing and aligning care with each older adult's specific health outcome goals and care preferences, which is a big mouthful, but we're going to break it down. But I think really importantly, this is not limited to end-of-life care. So most of us have had the experience, either ourselves or with individuals we love in our families, of having end-of-life conversations, perhaps having conversations around who we would want to make medical decisions for us if we could not make those decisions. What type of care we would want at the end of life. That's all very important, but this really goes beyond. This is what we want for our current care, what we want to get out of our healthcare, and we're going to break that down. And it is across settings of care. It's not just being asked in the hospital, not being just asked in the primary care practice, but this is something we want to be talking about everywhere. So why does matter most? Why is it so important? It is important to all of us. So it's really important to older adults. Older adults vary in what matters. If I have a room, excuse me, of 25-year-olds, most of them are going to want to live long, healthy lives. They're going to be pretty similar in what they hope to get out of their healthcare. If I have a room of 90-year-olds, there may be as many different answers for what they want their healthcare to do for them as there are individuals in the room. Older adults, they're very heterogeneous. And so we want to be asking about this to every single older adult we interact with. We know that having this conversation improves communication between clinicians and older adults, between older adults and caregivers, between clinicians and caregivers. It gets us all on the same page. It allows for older adults to be active partners in making healthcare decisions, because as clinicians, including me in this group, we understand what they're hoping to get out of their medical care. And it reduces burdensome or unwanted care while increasing care that individual is desiring, care that aligns with what matters to them. It's also important for our health systems. Well, we know that we're going to have better patient experience scores and retain patients and retain our providers. And it also avoids unnecessary, unwanted utilization. And then it's important for the rest of us. Again, it makes sure we're all communicating, we're all on the same page. It leads to improved relationships between older adults and their clinicians, between older adults and their caregivers. And really, it is the basis of everything else. I like to say, how can we provide any medical care if we don't know what matters to that person we're seeing? So this is just an example that we often use to think about the multiple medical conditions that many older adults have and all the healthcare related tasks that come with these. So you can see here in this example, this individual has hip pain and diabetes and heart issues and depression. And with that comes a whole host of medications, different medical providers, not only seeing a primary care provider, but seeing a whole host of specialists, maybe working with physical therapy on a regular basis, having other healthcare tasks that she has to do at home, like checking her blood pressure on a regular basis. And this can often be overwhelming, both in terms of time and the effort that goes into this. So I want you to keep this picture in mind as we move forward. So the next couple of slides, we're going to talk a little bit about the care for older adults who have these multiple conditions. And first, we know it can be of uncertain benefit. Now, why is that? Why would that care be of uncertain benefit? Well, someone who has diabetes and hypertension and dementia and osteoporosis, they are not typically the people that are included in clinical trials. So as clinicians, when we look at the trials, when we look at research to give us answers, that's very important to know. But the people included in those trials may not look like the older adults that we're taking care of. So we have to take a step back. We have to say, is this relevant to the patient who's sitting in the clinic room with me? And for them, what outcome would define a benefit? In addition, we know if we practice what I'm going to call disease-based medicine, just looking at the guidelines and treating the blood pressure and treating the diabetes and treating the cholesterol, we actually can cause unintentional harm. So 1 in 3 older adults has received a guideline recommended drug, but it actually harms or interacts with a coexisting condition. And this becomes more of a risk as we age because we have more chronic conditions. Next, the care that we provide is not always aligned with what matters most. So I told you a few slides ago that older adults vary. They're heterogeneous in what's important to them. And that includes in what they want out of their healthcare. So you can see here, 42% wanted to maintain function, even if it meant they didn't live as long. 32% wanted to focus on relief of bothersome symptoms. And 27% said, you know what, I want to live as long as possible, no matter what my function. We need to know these things as clinicians, or we're not going to be providing care that aligns with these wishes, okay? And then, as I mentioned, when we were talking about our example patient, care can be burdensome, especially when we have lots of chronic conditions. So the average older adult spends 2 hours per day on healthcare tasks. That's a big chunk of time. And every health encounter takes on average half a day. So every time we ask an older adult and maybe the caregiver accompanying them to come in for a lab draw, to come in to see a provider, to get a physical therapy appointment, we're taking a half a day of their time. So it's really, really important to know if that time is well spent, if it is aligning with what's important to that individual. So we want to really move our conversation. We want to move it away from you need whatever treatment for your whatever problem. You need to take that water pill for your heart failure, right? To a conversation where the clinician is able to say, knowing your health conditions, your overall state of your health, and what matters most to you, I suggest we try this. And that is going to vary. That's individualized for every single patient. It is not disease-based guidelines, one size fits all, because we know that simply doesn't work in older adults. So there actually is an entire framework to help us as clinicians to have these conversations. And I'm going to introduce this to you. And then I'm going to walk you through a resource developed specifically for older adults and their caregivers to do the same process so you can bring this information to your medical appointments. And this is a framework called Patient Priorities Care, and it's made up of two parts. The first is identifying health priorities. This is identifying what matters. It's the piece that I'm going to show you how you can do it at home. And then the second piece is the part that's going to be done by health professionals called aligning care. So once we as clinicians understand what matters to older adults, what matters to our patients, we need to then think about if the care they're getting is consistent with what they want. And we need to use those priorities as the focus of our treatment plan. We're going to use it to communicate with the patient, with the older adult and their caregivers. We're going to use it as we have trials of different treatments to know if they're working or not, and to prioritize care decisions, especially if there's differing perspectives. Now, I'm not going to ask for a show of hands, but I bet many of us on this call have had different clinicians, maybe different specialists, and one is saying one thing and one is saying something that actually conflicts with that. So this helps us all get on the same page because we know what's important to the older adult. And then we can always come back and update this as needed because, as we like to say, life happens. So if there is a significant health event, a significant life event, be that a loss of a family member, a move to a care facility, a global pandemic like COVID, we can go back and revisit what's important to us. So I'm going to walk you through this in a bit more detail. So what we know is when we think about our priorities, these provide us with direction. You can think of this as a compass. It's where you want to go. And then starts with your values. And we're going to talk about values on the next slide. From the values, we come to some specific goals, and those are stops we want to make along the way. And then as part of this process, we're going to think about what we would need to do with our medical care to meet these goals. And is that feasible? Is it worth doing to the older adult who we are taking care of? And then you may ask, how do you measure success, Dr. Caddick? You said you're not following every disease-based guideline. So how do you know if the care you're providing is working? We know that by going back to the goals and seeing if the older adult is meeting the goals that we have set together. Okay, so here are the 4 main value categories. They've done lots of work and have found that most of us, these are the 4 main buckets where we have values. Most of us are going to have values in all of these areas, and they are relatively stable over our lifetime. So our values don't really change during adulthood. So the first bucket is connecting. That's one of the key areas that older adults often tell me they care most about. And this is our relationship with our family and friends, with our community. You know, it could be within AARP. It's with our spiritual practices and our spiritual communities. So making those connections that Rose spoke so lovely about. Second is managing health. This is maybe what you think of more traditionally when you think of values around healthcare. So making sure our symptoms are well controlled, pain is controlled, we're not feeling short of breath. It's thinking about what is most important to each of us. Is it quality of life or quantity or length of life? The third value is functioning. So what for us means we're living a dignified life. What is important to us that we're able to do independently, and what are we willing to accept some assistance with? So this can be very, very important as our function changes as we age. And the fourth bucket is the biggest. It's called enjoying life. But this is a lot of different things. It's feeling, wants to jump ahead, feeling productive. That could be in our job. It could be in volunteering. It could be at home. It's personal growth. So learning, reading, listening to music, and it's our hobbies. It's recreation. It's things that are just plain fun that make our life worth living. So these are the values. So if I was having this conversation, I would talk with each of you about these different value categories and learn from you what's really important, what makes you the person you are. From this, we work to develop goals. And goals are how we show we are living our values. We're doing what matters. These are the activities that we want to keep doing, or perhaps that we hope to be able to do in the future. Now, we have a few rules about goals. They have to be really specific. They have to include exactly what you want to do in service of that value. Now, they can change over time. They have to be realistic. We have to think that we probably are going to be able to do them, or with some work, with some changes in your healthcare, we're going to get you to be able to do them. And they have to be actionable. So I'm going to give you an example. Sorry, I need to take a sip of tea. So one of my values, I'll use myself as an example, is my relationship with my daughter, being her mom. Most important role I have in life, most important thing to me in the entire world. Now that's a value. It's warm and fuzzy. I'm never going to stop being her mom. Never going to stop thinking that's an incredibly important relationship. I'm never going to say like, oh, done with that. I was a great mom, move it on. Now, I can set a goal related to that. I may say, I'm going to read to her 15 minutes, 5 nights a week before bed, right? Very actionable. It's specific, 15 minutes, 5 nights a week. It's probably realistic. We probably can do that. I didn't say we were going to read for 2 hours. And it's actionable. I can check it off on a calendar. So that's a good way to know if you've developed a goal. If you can say, yes, I did it, Dr. Caddick, I'm going to check it off on the calendar. Okay, we're going to come back to this, so don't worry. We also, as clinicians, want to understand healthcare preferences and trade-offs. So this is something you may never have been asked by a clinician, but we really should be asking it. So what healthcare task are you willing to do, are able to do, and what are we asking you to do that's too burdensome? You know, a lot of folks nod and smile and want to make whoever's seeing them feel good about, the plan, and then they leave and they don't do it because it's too much. We asked too much, or that medicine was too expensive, or they have bad arthritis in their hands and they can't check their blood pressure themselves once a day. And we want to think about trade-offs. When does the treatment plan maybe help us reach that goal we set, but it requires too much effort, or it creates even more symptoms? And when that happens, we have to go back and reevaluate. So I promise this is my only researchy slide, but I wanted to show you, this is a study they did on patients who were receiving what we call patient priority care, this method I've been walking you through compared to regular disease-based care. What they found with patient priority care, 66% of the time they were focused on the patient's goals, only 2% of the time with regular care. Older adults receiving patient priority care were 2 to 3 times more likely to have medications stopped that they did not want or were not finding beneficial. They had about 30% fewer tests ordered and 30% fewer self-management tasks added. And their treatment burden was decreased, and that's statistically significant. So I'm going to pause. I don't see anything in the chat. We will move on because I want to walk you through how you can go through the first part of this, the priority identification part at home, and take that information to your next medical appointment. So I want everyone on this call to feel empowered. You are in the driver's seat. I have put the website right here, and I'm sure Ariel can get these slides out to you all if I get them to her so that you have it. I am not going to walk you through every single slide on this website because we would be here till tomorrow, but I'm going to give you a good overview. Okay, so if you go to the website, this is what the front page is going to look like. It's going to say identifying my health priorities. And that's the process it's going to take you through. Okay. So it welcomes you. It talks a little bit about why health priorities are important. I'm not going to go through that in great detail because I hope I just convinced you of that. But, you know, the more you and your healthcare team know about what matters to you, the better you can work together. So as you proceed, it's going to ask you to sign in or to continue as a guest. Now, you can do either. We're not tracking your information, I promise. The benefit of signing in is it's going to save what you put in here and you can go back to it. If you proceed as a guest, that's great. You can still print out the worksheet at the end, but it's going to lose your information once you come out of the website. So anything you've done is going to be lost. Okay. So pretty easy, click, click. And then it's going to talk to you about the steps that you're going to need to complete. So I just walked you through these a little bit, but we're going to talk about them more. So first, identify what matters most to you. Values, those 4 value categories: connection, health management, enjoying life, and dignity or independence. Second, setting that health goal. Remember, we're going to be specific, realistic, and it's going to be meaningful. It's how we show that we're living what's important to us. It's going to walk you through reviewing your symptoms and problems, as well as the healthcare task and medications that you use. And then at the end, you're going to choose one thing to focus on, and that's what you're going to bring to your next medical appointment. So I'm going to show you a few screenshots so we know what this looks like. Now, I wanted to introduce you to Dave. Dave is an avatar that we have created. We use him in a lot of our training, both for clinicians and for older adults and their caregivers. He is embedded in this website. And if at any time you have questions, you're a little bit confused, you're not sure what a step could look like, you can click the Dave button and see an example of how he would fill out the question. So you can actually walk through looking at Dave and then thinking about this in yourself. So first up, you're going to select what matters most to you. You can select up to 4 items. And if what matters most to you isn't listed, let's come up with something not listed. Maybe what matters most to you is tying fishing flies, making really cool fishing flies. You can click other and type it in. So 4 things that are most important to you. This is going to help us get to your values. And out of those, you're then going to select a single item to focus on. And I just put these in as I was making these just randomly. So, you know, I chose activities that support my religious or spiritual life, comfort and function, and reducing the amount of time I devote to healthcare. But these are going to be what you chose it. So they're specific to you. And from those, we're going to build a health goal. So I had said, the website is telling me this, you said that reducing the amount of time I devote to healthcare was important. And your health goal is going to be the specific activity you most want to do. And you get to fill it in. So I typed in, I want to be able to attend religious services once weekly. Okay. So maybe the amount of time I'm devoting to my healthcare is interfering with that. Okay. Now we're going to move into our bothersome symptoms or health problems. So this is where you're going to choose 2 bothersome symptoms or health problems. You can see there is an other if what is listed on here is not what's most bothersome to you. So you choose a couple of those, and then it's going to walk you through reviewing your healthcare task and your medications. And again, here's where we want to find a balance. Here's the healthcare goal that you have set. And what do we need to do to reach it? Is it too burdensome? Do we need to go back and modify that goal? Or is it acceptable? You're willing to do these things to reach your goal. So I clicked some examples here for my self-care or at-home task. Perhaps I'm following a special diet. I'm exercising. I'm checking my blood pressure on a regular basis, and I'm using a cane when I walk. Next, it's going to ask you to click what other tests or treatments you have. You know, you see the examples here on the screen. You can also include an other. And then you're going to talk about healthcare visits that you have on a regular basis. So things that you do at least yearly or you think are coming up in the near future. So, you know, for many of us, that would be visiting our primary care clinician, visiting specialists. We may be going to see some mental health professionals or doing rehab. And of course, we include the other. You know, you might want to put your dentist in there. That may be where you put in your speech therapist, whatever the case may be for you specifically. And you want to put in your community programs, services, and supports, like the wonderful folks at Care Partners, perhaps are your community program. Or I've seen some folks from the Alzheimer's Association joining, you know, maybe that's something that's relevant to you. For our example, I said I was getting some in-home help. Maybe I have a visiting nurse who comes out and helps me. And then we want to know what healthcare tasks, again, are helpful and what are burdensome or not helpful. And you're going to bring this to your medical team. And you can click on these boxes to learn more. I didn't include that just for the sake of number of slides. So here I got to the worksheet and I filled it in. I'm able to choose up to 2 healthcare tasks that are particularly helpful and 2 that are burdensome. And for the ones that are burdensome, it does ask you just to type just a really brief bit about why you find it burdensome. And you can see my examples there. And then we get to the medication part. So some medications are helpful and some medications may be burdensome to you. So what medications are helpful? I chose to put in acetaminophen or Tylenol. You know, maybe that's helpful for my aches and pains. And I chose to put in a diuretic, a water pill called furosemide. And I said it was burdensome because I have to go to the bathroom all the time. And that's really, problematic for me getting out of the house. And you're almost there. Here you get to review what you have put in. You can go back and update and make changes or edits as needed. So that's great. And the final thing you're going to do is choose what is the one thing that is most bothersome to you right now. So it says select the one thing that most interferes with your goal. And my goal, if you remember, was to be able to attend religious services once weekly. So here is all the things that I said were bothersome to me. And the thing I decided is really interfering is having to go to the bathroom so often. Maybe it makes it difficult for me to get out of the house and go to those services. So the computer is going to give me my health goal. I want to be able to attend religious services once weekly. I can check it off on the calendar, right? I know if I did it or not. And it's going to give me the one thing, which is one symptom, health problem, health task, or medication I want to focus on to meet my health goal. And I want to focus on not having to go to the bathroom so often. So you've done it. Here we are. It's going to spread out my health priorities summary. The one thing I want to work on is having to go to the bathroom often so that I can be able to attend religious services once weekly. You can click on it from home and it's going to print it out, or you can save it as a PDF and share that with your clinical providers. So I am going to pause. I have just a few more slides, but I want to pause and ask if anybody has questions. Feel free to wait till the end as well, but I at least want to give people a chance. And you can unmute yourselves and just ask. You don't have to put it in the chat if that's not helpful to you.
How would this work if you've got multiple doctors?
Well, you really would be doing this once, Rose? I mean, that's a great question. I guess you could do it multiple times, but I would suggest you do it once with your core values and goal, and at least start there, because we really want all those doctors aligning around what's most important to you. Now, there could be situations, let's say you're having mobility issues and you're seeing physical therapy. You might go through this website, go through this process with that in mind, that I'm going to really focus on my mobility issues because I'm going to take this to my physical therapist, right? That would be an option. But at least for a first go, I would do this one time and share that with your medical team. Great question. I think I see something in the chat. Yeah, so the link is in the slides, and Ariel, can you send that out? And I will also try to get it into the chat here.
Yes. I don't think I have your slides as of today.
I will make sure you do as soon as we're off. Yeah.
Yes.
Okay.
And I can also, I'll see if I can find the link really quickly. I'll Google it because it should be.
Yeah, it's My Health Priorities.
Gotcha.
Okay. Well, let's move on. And then I hope at the end we can have more of a dialogue. I did want to just really briefly touch on the other M's, because as I said, these go together. We cannot divorce them from each other. So mobility is our next one. That really looks at fall risk and functional status. And as you can see from what we've talked about, obviously that's going to be very important for a lot of people in meeting their values and achieving their goals. Okay. I'm not going to go through all of this, but I wanted to just give you all a heads up that these are the sort of questions you're probably going to be asked if your healthcare clinician is going through this age-friendly model. They want to know how you perform your daily activities. These are things we all have to do every single day to take care of ourselves. Stuff like bathing, dressing, using the toilet, getting around our house, feeding ourselves. They're going to ask you if a caregiver assists with this, and if so, what sort of assistance are they providing? And it's really important for us to know if your function has changed. Has it changed in the last 6 months? Or if somebody comes into the hospital, we want to know, has it changed since you got sick, since you became acutely ill? Perhaps you were out on the golf course last week, and this week you're needing help with everything because, God forbid, you've got a really bad pneumonia or had a heart attack. So important to find out if there have been changes. And they're also going to ask you about what we call the instrumental activities of daily living. These are kind of the higher order tasks that are needed to get by in the community. So shopping, food prep, housekeeping, managing our finances, managing our medications, transportation. So these are definitely things that caregivers assist with each and every day. And individuals can continue living at home without being able to do these because of their amazing caregivers. But this is something else that's going to be considered under that mobility M. Mentation, I'm not going to dwell on. It's such a big one, but this is where we're really going to think with older adults and their caregivers about things like dementia or cognitive decline, something called delirium, which is an acute confusion that often happens in the hospital, and then mental health issues, including depression. And I think I don't have to explain. I think it's intuitive to all of us how these could really interfere with what matters to us and how we want to address them. And finally, medication. Medication is so important as we care for older adults. We know that medications come with a host of possible side effects, that how our body reacts to medications changes as we age, and that the vast majority of us take more medications as we get older, which increases the risk for medication side effects and interactions. So we really want to be thinking about that and considering if these medications are impacting the other M's. Are they impacting our gait? Are we becoming more unsteady because of a medicine we're on? Are they impacting our thinking, maybe making us confused or more lethargic, more sleepy, and how they interact with what matters to us? So I'm not going to go through all this. This is what we ask in my clinic, but it's really going deeper than just a list of medications. We want to know who manages medications. Is it the older adult? Do they have a caregiver assisting? Is it a visiting nurse? How do they take them? Are they taking them from the pill bottles? Are they using a pill box to organize them? Of course, always asking about over-the-counter medications and herbal supplements because these can interact with prescription medications. These often have their own side effects. Thinking about, do they ever miss a dose or forget when they need to take their medication? And of course, thinking of medications which have higher risk of side effects, things like our opioid, our stronger pain medications. And then as geriatricians, as if that wasn't enough, we have actually added a fifth M, and it is called multi-complexity. And that's where we put our traditional, what we call advanced care planning. And that's just medical speak for finding out things about like what people want at the end of life, who would make decisions if the older adult was not able to make those decisions themselves. This is where we put that more traditional end of life planning. So we are reaching the end, at least of the slides, but I hope the beginning of a conversation. But just to recap, age-friendly care focuses on the 4 M's, what matters, mentation, mobility, and medication. And I want to point out, what I see as the bedrock is aligning with what matters to older adults and their families. I like to say nobody comes to see me because they really want their blood pressure to be 130/70. That's not people's life goal. They want their blood pressure to be well controlled so they can continue to walk their dog every day or so that they can go to their grandson's Little League game. We want our healthcare to help us live better lives. We're not doing it to get to a certain number. I introduced you to the Patient Priorities Care Framework, which can walk us through getting to what matters, to that one thing that we can take into our medical appointments and share with our healthcare providers. And as clinicians, we really want to make sure care is aligned with the values and that our related goals can be optimized through medical interventions, that we're not actually making it worse, taking away from those goals by the care that we have suggested. So I'm going to stop sharing so that I can see everybody a little bit bigger and you all can see me. And what is anticholinergic? That's a great question, Rose, that I skipped over because I didn't know that people would really, it is a certain group of side effects. There are medicines that are more likely to cause this group of side effects that includes gait instability, so difficulty walking, confusion, urinary retention, the list goes on. A bad actor in this area that we all know is Benadryl. You've all heard of Benadryl. You take for allergies, really not good in older adults because it has a high anticholinergic load. So this is something as clinicians, we're often looking at all the medicines to make sure they're not highly anticholinergic because, again, could impact our thinking. It can impact our walking. It can impact what matters to us. Great question. Other questions, either please feel free again to unmute and speak, or if you prefer, put it in the chat.
I have a question. So what happens if you are seeing a doctor or a medical professional that's not familiar with this model, and they have their own way of, traditionally going about,
of course,
serving patients. How do you invite them, if you will, to adopt it or present it to them, because they may think it's kind of weird or not be open to it?
Right. No, I think that's a great question. I think, we're all learning. This is a change from how all of us were trained. So I think letting them know, boy, I appreciate that you're covering all my health issues, but I wanted to take a minute and talk to you about what I hope to get out of my healthcare. And I actually found this really great website, heard about this really, and I went through it, and I wanted to share that with you. And we may not have time today, to go into it. I know I'm just bringing this to you, but could we schedule a visit that I could come back and we could talk about it more? They may need a little time to process. But I think this is advocating for yourselves. This is no different than going in with your list of concerns. And so we want to normalize it. And I would say, I think 99% of the time they're going to be open to this. If you hit on someone who just isn't going to go there, no matter how you present it, it may be time then to bring it to somebody else. And, lots of, I not picking on physicians, I am one, but, a lot of them work with social workers. That may be something that they're able to help advocate for you around. Nurses, it takes a team. And I think, make use of those resources.
Thank you. Does anybody have any questions or feedback? I'm quite interested to if you all are planning to maybe adopt this or take this to your doctor, or if you all have any stories where this
have you been asked this? Maybe you've already done it. I don't know.
Well, I think it's, it's a really good tool, because some of these things my doctor and I have not discussed. And I'm going to go through the form and print it out and use it the next time I go to see my primary care physician. Because this is a totally different way of looking at things, and putting my needs first instead of being told, well, Medicare isn't going to pay for that, or they're not going to approve that. Or, sometimes you just have to learn to live with the pain, with a period behind it. No, but we're going to work on seeing how far we can get you. But no, just sometimes you just have to learn to live with the pain. Mm. And I think as older adults, it's once we get to a certain age, it's just an expectation that you're going to have this, you're going to have this, you're going to have this. And if a 30 or 40-year-old person will come in with the same symptoms and all, they would have a different discussion. But once you get to 60 and above, you're just getting old. Mm. That's just what happens to people your age.
And that's ageism, and we want to change that, right? So I think I really like how you said that, you have to live with the pain. So I think that I'm going to kind of play off of that to give an example. So, one thing we think about a lot with this that you could ask yourself is, what would you be doing if you didn't have the pain, right? So let's take an example, knee pain. Okay. And you got really bad arthritis, you're going to have knee pain. It's never going to be 100% gone. Okay. And you could say, I hear what you're saying. However, I want my knee pain to be well controlled, or controlled enough that I can walk 3 blocks, to the grocery store without being in significant discomfort. That's very specific. I think they're going to find that really helpful because you didn't say, I want to be able to go run a marathon. Like, that's not realistic. We're never going to get the pain, you know, like that's not going to happen. Okay. But by us saying, I want to walk 3 blocks to the grocery store without being in significant pain. Now that's something we can work together on, right? It's realistic. We can probably get you there. So that's where that specific, you know, if we're having a conversation, which is, well, you're going to have some pain and I don't want any pain, we're not meeting in the, you know, we're not really communicating about it. So thank you for that example.
Thank you. That's a good way to kind of frame it, because a lot of times we're like all or nothing. I don't want any pain. I don't want any stress.
It's not all
my problems to
nothing.
go away.
Sorry, y'all.
I wish it. And we know, and I think we all know that, but reframing it to focus on a particular goal and say, I know that I'm not going to, like you said, the pain isn't going to go away, but I want to be able to walk or for a couple of, you know, mile or a couple of blocks, or I want to do plant something in my garden, you know, in April, you know, not every day, but just once every now and then. So thank you for framing it that way. So it's really helpful. This is great. Any other questions or comments? We'd love to hear how you plan to use this, or any reservations, you know, hesitations, like I'm afraid to talk to my doctor. Someone in the chat said this is new information, so a lot to process there.
And Samsung SM, not to put you on the spot, I did see you unmute. So if you have a question, please, we're happy, or a comment, we're happy to hear from you.
Awesome. I'm not sure if I hear, do you hear? I don't know if I hear something. I don't hear any. Okay. I heard something, but I couldn't tell if it was just low and we just couldn't hear. Hey, Samsung SM, are you there? It looks like I saw a green box pop around your Zoom. Okay, let's see here. Thank you. This information has been very helpful. I have gotten a lot out of it. So, all righty. Angela, did you have anything else that you wanted to add, or any parting words?
I would just say, give it a try. It's, you know, you always can do it and then go back and change it. It's not forever. It's today, right? I think you will be pleasantly surprised when you bring this to medical appointments. I think people are it's gonna be a change, but they're gonna, I think, be receptive. And I will get the slides to Ariel this afternoon to get out to you all. I appreciate you taking the time to be here, but I did see Diana go off or turn her camera on. So
I saw that too. Hi, Diana.
I was just going to type it in, but since you called me out, I'll say it. I just wanted to, yeah, it was really helpful for me. I think in a lot of my medical appointments for my mom, being overwhelmed is just a normal part of it. But what I really appreciated, I'm just going to read what I wrote, but what I really appreciated was the process of looking at values, just trying and then framing like the communication with the medical personnel, but starting with that, and then even like looking at like just the process of how we communicate. That was helpful for me, because I was like, sometimes I feel like I just word vomit with the doctor, and they're like, okay, well, we have 20 minutes. So what should we look at? And then a lot of it too, I'm like, no, that's not helpful for my mom because she'll get sick with that. And so I've not had the best experiences, but I think as you were presenting, I was like, oh, it would have been so much helpful if we started with the values, and then at the different approaches of just thinking about like, what's the priorities for my mom, and like communicating from that place. So that was all over. But thank you so much. I really appreciate it.
Oh, no, it's my pleasure. And I think you're right. And I think it will help them, the providers as well, to have like a focus.
Absolutely. Thank you, Diana. Rose?
Okay, yes. When I am giving my presentations on Prepare to Care, I will be referencing this website to the participants as part of it, as a tool, because I think this is very it's very important. So so Dr. Caddick, I will be referencing you and this
That's
website.
Right.
Yes. So
awesome.
And I do see here in the chat a question, well, a comment. If my body is adjusted to the medicine, how can I reduce its usage? The mental idea of reducing makes me a little nervous. You know, first of all, I'd say talk to your healthcare provider. You may not need to reduce. Maybe you're doing really well. Maybe, you know, maybe that medicine is helping you do what matters to you. If we feel like we need to reduce that conversation, I think change makes us all a little nervous. You're not alone in that. And that's where those trials that I mentioned come in. So, you know, it may be saying we're going to reduce that medicine a little bit, and I'm going to call you in a couple of weeks and see how that's going. And if there's a problem beforehand, you call me. This is not, you know, I hate to, I'll let you in on a secret. We don't have a cookbook that tells us exactly what to do. A lot of this is working together. We're going to try this. And if it doesn't work, we're going to try that. But we're going to keep in communication and work together until we find, you know, the best solution for you. So thank you for that comment.
Absolutely.
Person-centered care is very important, and caregiver support. Thank you. Yes. That focus on dignity and respect. We all deserve that and should be giving that to everyone we care for, right?
Absolutely. Well, thank you all so much for joining and being here today. Thank you, Dr. Caddick, for this wonderful presentation. I encourage each of you all to try out these new concepts when you can. We will be sending out the recording as well as the slides and the link for you to plan out your values and, you know, print it out so that you can share it with your healthcare team. I would personally like to hear feedback, you know, so if you try it out, if you go to your doctor in a month or two and you say, hey, Ariel, that really worked, it's very helpful for us because Angela and I, we work directly with each other with the Geriatric Workforce Enhancement Program. So this is great information for us to say, hey, this is really working. Let's get this out to more caregivers and more older adults. So we really appreciate the feedback, just so we know how it's working for you. So it's all an exchange, right? All an exchange. So definitely let us know if you need anything. Let us know if you have any topics that you're interested in learning more about. We have kind of mapped out the calendar for the rest of the year, but we're happy to make adjustments and add things where we can, particularly with our caregiver conferences. So thank you all so much, and y'all enjoy the rest of your afternoon.
Thank you all. Take care.
Thank you, Rose. It was nice meeting you. It was really nice meeting you. Do I have your contact information, Rose? You're muted. You're still muted. Let's see.
Okay. It should be on one of the emails.
Okay. I think Jennifer said she told me who was coming, but I don't. Did she CC you on that email? Were you copied?
I'm not.